Welcome to day 2 of the Digital Health Assembly. If this is your first day, the fire exits in this room are in the corners. There are no fire alarms planned. I'm James Davis. I'll be looking after you guys when you're in this room. And it is my great pleasure to welcome to the stage today to give the opening address Professor Andrew Morris, the Chairman and Centre Director of the Fire Institute, Scotland.
Good morning, everyone. It's a great pleasure to be here. Can I thank David Ford, Stephanie and the team for putting on such a terrific conference in a great venue. Reminds me once I spoke at Melbourne Cricket Ground, which wasn't quite as nice as this, and the audience were sort of overlooking the pitch, and there was a match ongoing at the time, and halfway through my talk I got a standing ovation because someone had just hit a 6. So I hope the same happens today. So I'm going to give you a very brief update on the Fire Institute. I'm going to try and convince you in the next 10 minutes that if the UK is going to be internationally competitive in data-intensive medicine, data-intensive health systems and digital health, then we need 3 things. Firstly, in terms of academia, we need interdisciplinarity so that computer science comes together with mathematics, statistics, science and healthcare to co-create solutions. Secondly, we need collaboration across sectors, so that's industry, NHS, social care and academia. And thirdly, that we need to operate at scale, and that means gearing up across the UK. So I'll just give you a quick overview of the FAR. I think yesterday's theme was about, I've made up this word, hyper-exponentiality of our health systems, which basically means there's loads of data out there, whether it's the internet and cloud reaching to every corner of the globe, the socialome, the exposome in terms of pervasive environmental sensing, as well as the revolution in omics. You know, the UK has just purchased technology which will give us genomes for about £600. So this is the world that we live in. So how are we going to embrace this data-intensive world? So our vision with the FAR is to harness these data and to set the international standard for the trustworthy reuse of initially EHR data, but spanning out into other heterogeneous data sets for large-scale research. Initially, it was a research collaboration. So the 10 funders, the MRC are here today, we're very grateful, but 10 funders came together and had a competition and awarded 4 centres to do good research, to capacity build, and to look at cross-sectoral data linkage. But it's evolving over time. I should just briefly mention who was William Farr. Some people suggest this looks like Ronan Lyons after a night out. But he was actually the father of medical statistics. He was the chap who insisted that the cause of death was inserted on death certification in the UK. He was a graduate of UCL, and he said diseases are more easily prevented than cured, and the first step to their prevention is the discovery of their exciting causes. Hence, it's very apt that we've called this National Institute after Sir William Farr. So in terms of the competitions, it was very collaborative. We had 4 centres, but it embraced 22 universities and 2 MRC units. So this is a real attempt at coalescing expertise across the UK, and they're listed there. In terms of people, and most of them are here at this conference, although these look like 4 UKIP candidates, they're not. There are 4 directors. Ian's here, Harry, Ronan, and myself co-direct across the UK. We have co-directors in David, John, Jill, and Liam. And they coordinate FAR activities. We were then very fortunate to receive an additional £20 million of capital expenditure from the Medical Research Council to act as an accelerator for our ambitions. And what we've expended those funds on is to create physical centers, to create safe havens, to execute excellent research, to create an integrated digital e-infrastructure, to facilitate new data access and to communicate across the UK. The ambition now is to create a virtual single national institute. So an example of the capital spend from Scotland is that we've got great facilities. We've enabled 3 new data sets, the National Imaging Archive of every image taken in Scotland since 2007, laboratory data, GP data underpinned by a private cloud, high-performance computing infrastructure. So you get the idea. The other bridge is with the ESRC and the Administrative Data Research Network, because you'll be aware that a lot of determinants of poor health lie out with health in terms of the environment upon which we live. So we've got very close linkages with the Administrative Data Research Network. So shown schematically, we're building up the ability to link data from cradle to grave from health and social care across the UK. At a national level, illustrated in this slide. So just to give you a sense of progress, this is a picture of the Swansea development, the superb refurbishment of space in Manchester and Liverpool. I'm having struggling with my technology here. Oh dear. Oh, there we go. In Scotland, we've got superb facilities initially in Dundee and Edinburgh, spanning out to Glasgow and Aberdeen. And in London, it skipped a slide. We've also got facilities at 222 Euston Road. It's important, though, that FAR is just one key part of not only investments, but in the landscape. Here's just a list of some of the related initiatives, whether it's UK Biobank, Genomics England, the innovation centres in Scotland or in Wales, the MRC Medical Bioinformatics centres. And if the UK is going to operate at scale, we need a way of weaving collectively these investments together. And that's what the FAR Institute Network is aiming to do, again supported by our 10 funders. Because if we are to deliver studies of 65 million people in the UK, which is our opportunity and arguably also our need in terms of being internationally competitive, we've got to be at the forefront of the trustworthy use of data. We also need to reduce complexity and duplication by looking at standardization and harmonization across these initiatives and sectors. So metadata, the definition of standards and open standards is going to be key. And we're also going to need to secure buy-in from literally thousands of NHS entities. So the opportunity is there, but so is the challenge. Capacity building is also going to be a challenge. The CEBR estimate the UK needs 58,000 data scientists by 2017 if we're going to realize the economic growth advantages. So that's what the network aims to do, and it's about this facilitatory, coordinating role which will strengthen partnerships across the UK. Again, we've got a small, lean team, and they're all here today. Cherry, Catherine, Georgina, and Ed, who are driving this connectivity across the 4 centres. And initially, we've set out our stall by saying there are 7 pre-competitive strategic priority areas that we think we should support through active working groups engaging colleagues across the UK. And just to briefly skip through each of these, public engagement is absolutely number 1 in our sights. Simon de Negre from NIHR, Sarah Cunningham-Burley are leading on this, because if we don't get this right, if it's not seen to be trustworthy, we will not be allowed to use data in the creative ways that we think can add value to improve quality. Capacity building, we've got a team looking at that, looking at portfolio of data science and health informatics research opportunities in terms of training and education across the UK. We're looking at the value of the UK cohorts. Currently, 2.5 million people, British citizens, have signed consent to participate in a cohort. We owe them a huge debt of gratitude. We can link those deeply phenotyped patients to longitudinal outcomes to discover new science. And Ronan and Michaela Benzaval are leading on that cohort study linkage. Methodology research, Ian in the front row here has created a faculty, a college of experts of 34 people to look at innovative methods for large-scale analysis of health and non-health related data sets in terms of data science. Best practice in governance, Karina and Rosemary, who's the Information Commissioner in Scotland, are looking at how we can develop trustworthy and proportionate approaches to governance. I'm struggling here. And it's really important. This is not, it's still very much in the public eye. Why did care.data go so wrong? Communications, Catherine and the team are looking at communications across the UK, and all this is accessible on the FAR website. And lastly, and very important for this meeting, is partnership building. We're really determined we don't only collaborate internally with the NHS and academia. How do we build trustworthy, deep, long-standing industry collaborations, which are seen to be in the public good? So I think the open innovation models we heard about yesterday are going to be really important. And Andy Rodham and Harry Hemingway are leading the partnership building group. So that's the FAR in 10 minutes, but we mustn't be too insular. I'm a member of the Global Alliance for Genomics and Health. Our colleagues out of Harvard are trying to do this on a global scale. How can one link and share genomic and clinical data to discover new biology, new care pathways, new targets on a global scale? And I would hope that we in the UK can play a leadership role in the Global Alliance. So here we are at the Digital Health Assembly in Cardiff, so all credit to the team, but also to flag our international conference at another sporting stadium in Scotland, in St Andrews, on the 26th to the 28th of August of this year. So we hope to see you there. When we'll be looking at the science, the research, the capacity building, the governance, the public engagement in a lot of detail. So please submit an abstract, come along and bring your clubs. So of course, predictive analytics is everywhere. So I worked with my colleagues in industry to predict the score of the Scotland versus Wales game on Sunday. So I'm very pleased, David, that with a great degree of accuracy, we predicted that the score would be Scotland 26, Wales 3. So if anyone wants to wager me £1, then I'm game. So thank you very much. So welcome to the FAR Institute and the network. It's a very inclusive endeavor. There are opportunities for outstanding research. We want it to be inclusive, outward-looking, and partnerships with industry are an absolute priority. So thank you very much for listening.